Hi there! Let me introduce you to the LUMP assessment of stages of employment readiness, LASER. This assessment was developed in 1997 in order to measure client readiness towards return to work. It consists of 14 items corresponding to Prashaska stages of change model. It was designed to predict the subsequent employment outcomes with 3 stages of readiness for interpretation, which are pre-contemplation, contemplation, and action, and it is based on the parallel model for stages of work readiness. It is available in English, Chinese, and Malay version, which were translated by qualified translator from Pusat Bahasa Universiti Teknologi Mara, UiTM. This assessment is a self-rated assessment. The purpose of this assessment is to assess welfare recipient employment readiness, to distinguish stages of readiness to work among injured workers, and to measure one's psychological readiness to return to work after an extended period of unemployment due to disability. There are 3 components being assessed, which are pre-contemplation, contemplation, and action. This assessment should be used to clients ranging age from 18 to 58 years, applicable those with traumatic brain injuries that are undergoing rehabilitation, injured workers who had gone through the return to work process, and welfare recipient from a work training program, which been tested on clients that have depression, mood disorder, learning, and cognitive disabilities. This assessment should not be used to clients that have poor cognitive ability and have poor insight. Administration procedure. First, client needs to read through the instruction and complete all of them. But if the client reading level is below primary 6, then the therapist has to read the instruction and each question to the client. Then, for each question, there is a statement describing how a person feels when starting a job service program. The client has to indicate his or her level of agreement for each statement at the moment. The client will stop at any point if they feel uncomfortable or refuse to continue.
Assalamualaikum, I'm Agnizati and I'm your therapist for today. So how are you?
I'm fine.
Okay, good. Okay, today we will do LASER assessment. The purpose of this assessment is I want to measure your readiness towards return to work. So you may take a look at this questionnaire. There are 14 items in this assessment and you have to complete and read all of them from strongly disagree to strongly agree. So you may start now. You can ask me any question if you find any items you didn't understand. Okay, you may start now.
The client will be rating the items on a 5-point Likert scale, which from strongly disagree to strongly agree. Then, after the questionnaire is completed, the therapist has to put the score into corresponding box in the scoring sheet and add the score for each stage. The sub-score will indicate the corresponding stages of readiness of the client toward employment.
Okay, so based on your scoring, you have the highest score in pre-contemplation stage, which means that you do not see unemployment as a problem, you are not interested in working yet, or you believe that you cannot work. So thank you for your cooperation today. See you on next section. Thank you.
Scoring interpretation. The highest score among the 3 groups indicate the stage where the client tends to belong. The client just now have the highest score in pre-contemplation stage. But what does it mean? It means that the client do not see unemployment as a problem. They are often not interested in working or do not believe that they can work. In contemplation stage, the client aware of the problem and considering the prospect of change, but have not yet made a commitment to change. In action stage, the client engaged in job-seeking behaviors and remove many of the barriers related to returning to work, and they're looking for assistance to return to work. Reliability. For task retest, the ICC on item score of the Chinese LASER range from 0.55 to 0.79, but for the Malay version range from 0.71 to 0.92, which indicate higher reliability when compared to the Chinese version. For internal consistency, the internal consistency for the contemplation and action yielded a satisfactory ICC index, but for the pre-contemplation subscale was rather low, 0.69. The corporate alpha for the pre-contemplation and contemplation scale are 0.77 and the action scale is 0.82. For FAST validity, this assessment has been conducted in a welfare to work program from Readiness agency and the total number of complete and usable LASER survey was 149. Other 39 surveys rejected because of incomplete items or the participant refusal to complete the intake, but it shows that LASER assessment was understandable and relevant to the target population. For content or constructivity, the study done by Chand, 9 out of 14 lesson items were rated with 4, which agree, and 5 very agree. However, 4 items were rated by 3, neutral, and 1 item with 2, which is disagree. In Malay version of Result, the panel members rate between 4 to 4.67 to 5, which indicate very agree for each item. This shows that translation of Result into Malay version is not affecting the content validity. Predictive validity, the results support the hypothesis that those in action group will tend to have the best employment outcomes, the pre-contemplation group had the worst employment outcomes, and the contemplation group was in the middle. Discriminant validity, the coefficient between the theoretical factors and the observed variables, item 1 to item 14, was significant and ranges from 0.45 to 0.83, and the CFA supports the leisure 3-factor structure that correspond to the 3 stages of employment readiness, which are pre-contemplation, contemplation, and action. Advantages: easy to administer, question is simple and easy to score, easy to calculate by adding the total score, have good reliability, and the predictive validity was well established by having different employment outcomes correspond to the participants' stages of employment readiness. Disadvantages: the client judgment during self-rating could lead to underestimation and overestimation of their performance. There is limited studies and psychometric properties in this assessment.